A new survey by the Canadian Medical Association has found that doctors are increasingly intervening to address harm to patients who followed incorrect health information online. The survey reveals that 97% of doctors who responded have had to step in to prevent harm or deal with the consequences after patients access misleading or false online health advice, some of it generated by AI. A previous CMA survey done last November found that 89% of respondents go online for health information. Our next guest is a family doctor and a clinical researcher from Toronto, Dr. Iris Gorfinkel. And Dr. Gorfinkel, are you surprised at all by these findings?
Not a bit, not a bit. In fact, most of the patients I see are going to access information online, and why wouldn't they? We're curious about our health. Our body is sending a signal. We want to know what's wrong.
Have you had firsthand experience with a patient coming in and gotten not just to the point of following incorrect online information, but where it's on the verge or actually causing them harm?
Absolutely. I would say it's a daily event that patients come in. And most patients, even though I've known my patients for 26 years, they're going to go online to better understand it. And on the one hand, it's a form of engagement, right? It can actually teach quite a lot. So from that perspective, I welcome it. But the problem is, it's often wrong. And the biggest problem that I see, I mean, statistically, it's like a coin flip. So patients go online, they're trying to figure out, what do I have? And we know the overall stats. 50% of the time, half of the time, the diagnosis is wrong. So a lot of the time, they're worried that it's something terrible. So for example, the symptoms of ovarian cancer, well, they're pretty nonspecific. Nausea, mild pain, sometimes fatigue, sometimes weight loss or weight changes. So these are universal symptoms, and yet AI is telling them this could be cancer. And naturally, they're extremely worried. So from my perspective, as soon as that big C word comes in, I'm more likely to do tests. And now we don't even have a good test for ovarian cancer. So it is a serious problem.
You're very charitable and talking about how there's some good that comes out of this, that, the patients who are seeking out this information are engaged, and engagement is a good thing. But I feel like it's not always good. Like in my business, I run into people who are, painfully cynical about the world and about journalism, and I can't really have a conversation with them because they're so sure that what I'm doing is deeply flawed. Do you run into that, where a patient says to you, like, yeah, big medicine or big pharma is behind this, and I just don't trust you, doctor?
I think there's always an aspect of that, but my job as a doctor is to try to bridge that gap. So if you have a concern, Ian comes to me and says, gosh, I'm really worried. I got this blood pressure reading, and I was looking on AI, and I'm concerned about fill in the blank, heart attack, stroke, whatever it is that you've read about. Well, my job is to try to bridge that gap and make that understanding and contextualize it in terms of the true risk. So it can be a good thing in terms of engagement, but it can also be a bad thing. It can miss important diagnoses, critical diagnoses, time-sensitive diagnoses, and I worry about that. I had one patient, and she thought she was having heartburn. Actually, she was having angina. So that's potentially risky heart attack. So we can get into that territory really easily, where it undercalls a serious problem or overcalls a non-serious problem.
Let's finish with this. I'm lucky. I have a fantastic family doctor. I feel like your patients are very lucky to have you. What's your advice to those many, many people watching who cannot get a primary care physician or nurse practitioner?
It is so worrisome. And I wish I had a slam dunk answer. If you can get help virtually, that's still pretty good. If you can get help virtually with the same practitioner, that's even more valuable. There is no substitute for a doctor who knows a patient well. Because I've got patients, they overcall everything. And then I've got some other patients who undercall everything. And so getting to know and navigate those waters is really important. And also prioritizing problems as patients get older. It's actually really tricky to do. And I'm so privileged because I've known my patients for 26 years. But a lot of people, they don't have that in their lives, right? 1 out of 5 Canadians don't have that. Engagement is good. Learning is good. Do not trust AI to tell you your diagnosis. That's the main messaging here. And if you don't have a family doctor, keep trying to get one, because primary care makes a person live longer and live better.
Yeah, I mean, we have a few crisis points in medical care in this country, and the lack of primary care providers for so many Canadians is one of them, and it's a story we'll continue to stay on. Dr. Iris Gorfinkel, family doctor and clinical researcher, thank you very much.
Many thanks for having me.